Harmony Insurance Group welcomes you to our educational series on Medicare. Medicare can be confusing to understand, which is why we feel obligated to educate on Medicare. So, what is Medicare Part A? To start, Medicare Part A is referred to as hospital insurance, and you'll see why throughout this video. What does Part A cover? Inpatient care in a hospital and skilled nursery facility, hospice care, home health care, and long-term care hospital services. Medicare Part A covers inpatient hospital care if you meet both these conditions. You're admitted to the hospital as an inpatient after an official doctor's order, which says you need inpatient hospital care to treat your illness or injury, and the hospital you are receiving care from accepts Medicare. What are your costs for inpatient hospital care? First, you'll be required to pay a $1,600 deductible, which covers days 1 through 60. Days 61 through 90, you'll be subject to a $400 copay per day. Days 91 and beyond, you'll be subject to an $800 copay for each lifetime reserve day. You have a total of 60 lifetime reserve days throughout your life. And if each day after your lifetime reserve days, you'll be responsible for all costs. Please note that a benefit period begins the day you're admitted as an inpatient in a hospital or skilled nursing facility. It ends when you have not received any inpatient hospital care for 60 days in a row. For example, if you're admitted to the hospital and then you're discharged from the hospital for a total of 20 days, but then readmitted, you are still under the same benefit period as the 20 days does not exceed the 60 days. Medicare Part A inpatient hospital care covers semi-private rooms, meals, general nursing, drugs, and other hospital services, and supplies as part of your inpatient treatment. Medicare Part A inpatient hospital care does not cover private duty nursing, private rooms, unless medically necessary, television, phone in your room, if there's a separate charge, personal care items like razors or slipper socks. Medicare Part A skilled nursing facility SNF. Skilled care is nursing and therapy care that can only be safely and effectively performed by or under the supervision of professionals or technical personnel. It is health care given when you need skilled nursing or skilled therapy to treat, manage, and observe your condition and evaluate your care. What are your costs with Medicare Part A skilled nursing facility SNF? As stated on Medicare.Gov, days 1 through 20 you have a $0 copay per day. Days 21 through 100 you are subject to up to a $200 copay per day. Days 101 and beyond you are subject to all of the costs. So what does Medicare Part A skilled nursing facility SNF care cover? A semi-private room, a room you share with other patients, meals, skilled nursing care, physical and occupational therapy if needed to meet your health goals, speech-language pathology services if needed to meet your health goals, medical social services. Medication. Please visit Medicare.Gov to see what medications may be covered. Medical supplies and equipment used in the facility. Ambulance transportation when other transportation endangers your health. Medicare Part A long-term care hospital services are acute care hospitals that provide treatment for patients who stay, on average, more than 25 days. Most patients are transferred from an intensive or critical care unit. Medicare Part A long-term care hospital services cost state. You do not have to pay a deductible for care you get in the long-term care hospital if you are already charged a deductible. If you are not charged a deductible, you'll be subject to the Part A $1,600 deductible, which covers the first 60 days of care. Days 61 through 90, you'll be subject to a $400 copay per day. Days 91 and beyond, you'll be subject to an $800 copay per each lifetime reserve day. Used each day after the lifetime reserve days, you'll be subject to all costs. Medicare Part A long-term care hospital services include comprehensive rehabilitation, respiratory therapy, head trauma treatment, and pain management. Medicare Part A hospice care is care you qualify for if you have Medicare Part A and meet all of these conditions. Your hospice doctor and your regular doctor, if you have one, certify that you are terminally ill with a life expectancy of 6 months or less. You accept comfort care, palliative care, instead of care to cure your illness, and you sign a statement choosing hospice care instead of other medical covered treatments for your terminal illness and related conditions. What are Medicare Part A hospice care costs? You generally pay nothing for hospice care. You pay a copayment of up to $5 for each prescription for outpatient drugs for pain and symptom management. You may pay 5% of the Medicare-approved amount for inpatient respite care. And you may have to pay for room and board if you live in a facility and choose to get hospice care. Medicare Part A hospice care coverage includes doctor's services, nursing, and medical services, durable medical equipment for pain relief and symptom management, medical supplies like bandages or catheters, drugs for pain management, aid and home care services, physical therapy services, occupational therapy services, speech-language pathology services, social services, dietary counseling, and spiritual and grief counseling for you and your family. Medicare Part A home health services are Medicare Part A or Medicare Part B covered eligible home health services. Usually a home health care agency coordinates the services your doctor orders for you. The home health agency caring for you must be Medicare certified. Medicare Part A home health care coverage includes part-time or intermittent skilled nursing care, physical and occupational therapy, speech-language pathology services, medical social services, injectable osteoporosis drugs for women, durable medical equipment, and medical supplies for at home. Most of this information was found on Medicare.Gov, so please visit Medicare.Gov, speak with your pharmacist or doctor, and speak with your Medicare agent before using any of this information.